Madam President, the number one preventable cause of death in America today, tobacco. People who use tobacco, smoking and chewing it, develop a myriad of health problems, and many die prematurely. Tobacco companies are a big business in America. They have been for a long time. And they really try their best to recruit new customers when they go into junior high and high schools. Now they're in the e-cigarette business too, but I want to stick with tobacco for a moment. The notion, of course, is if you can addict a child to nicotine, they'll continue to smoke and eventually become a lifelong user of tobacco products. It's been a long time since I've engaged this industry in political contest. It was a little over 25 years ago when I was a member of the House of Representatives that I boarded an airplane in Phoenix, Arizona at the last minute, United Airplane, and went to the ticket counter and said to the woman at the counter, "Can I get on this plane?" She said, "If you hurry, you can get on there. Here's your seating where you're going to be seated." And I said, "Wait a minute, this is in the smoking section of the airplane, and you've got me in a center seat in the smoking section. Isn't there something you can do?" And she looked at my ticket. She said, "No, Congressman, there's something you can do." So I got on that plane and flew from Phoenix to Chicago in the smoking section of the airplane. There used to be such things. And thought to myself, this is madness. Here I sit, a non-smoker, breathing in all this secondhand smoke, and there is an elderly person in the so-called non-smoking section 2 rows away, and there's a lady with the baby, and why in the world do we have to be subjected to this? So I came back to Washington, introduced a bill to ban smoking on airplanes in the House of Representatives. After a lot of work and a lot of good luck, I found out that the largest frequent flyer club in America, the House of Representatives, didn't much like smoking on airplanes either. And I won. Surprised a lot of people. Beat the tobacco lobby. Called my friend, Frank Lautenberg, the senator from New Jersey, asked him if he would take up the cause in the Senate. He did it masterfully. The two of us passed a law and changed the way America looked at smoking on airplanes. Neither Senator Lautenberg nor I knew that this was a tipping point in history. I didn't know it. But people started thinking, if secondhand smoke is dangerous on an airplane, why isn't it dangerous on a train, in a bus, in an office building, in a hospital, in a restaurant? And today, 25 plus years later, if you walked into someone's office on Capitol Hill and they had an ashtray in the middle of the table, you'd think, what are they thinking? People don't do that anymore. It used to be standard. And no one thought twice about lighting up. That was just your personal preference. Things have changed in America. And the number of people using tobacco products has declined because they've come to understand it's dangerous. It can kill you. But we aren't the only country on earth that has figured this out. Many other countries are ahead of us in terms of regulating tobacco. If you travel overseas, take a look at cigarette packages. Ours still look pretty fancy. They've got a little label on them. But in other countries, the cigarette packages are very stark and very limited in what they can say about the product. Most of what they contain are healthcare warnings. Tobacco can kill you. Tobacco can harm a fetus in a pregnant woman. And these stark reminders are to discourage people from using tobacco products because countries overseas, just like the United States, understands how dangerous that they are. So it was in that context that I was amazed to read a few weeks ago, the New York Times published a devastating series of articles on how the United States Chamber of Commerce has been playing a global strategy to fight against effective tobacco control laws in other countries. The United States Chamber of Commerce fighting tobacco control laws in other countries. Why would the United States Chamber of Commerce, once considered a pillar of the American business community, be a champion promoting the sale and consumption of a deadly tobacco product in another country? It doesn't compute. One reason, the power, the money, and the influence of big tobacco is still very strong. The stories and letters published by the New York Times made it clear that the U.S. Chamber of Commerce has effectively rented out its letterhead to the tobacco industry, jeopardizing not only the reputation of the chamber, but all the member companies that belong to it. I stand here today to salute one company that has fought back at this revelation of this activity by the U.S. Chamber of Commerce. CVS Health, you know them from the drugstores and pharmacies? CVS Health announced it was going to quit the U.S. Chamber of Commerce because the Chamber's efforts to promote tobacco conflict with the CVS corporate policy that decided over a year ago to stop selling tobacco products in their drugstores. I want to congratulate CVS Health. It's pretty bold when they decide they're going to walk out on the U.S. Chamber of Commerce because of these rotten policies they have in discouraging tobacco control overseas. Maybe this decision by CVS will give the Chamber of Commerce a reason to think twice about a policy that's going to result in deadly addictions and terrible disease. It should. The Chamber should end this insidious campaign as quickly as possible. Without question, CVS Health has shown again, as they did last year, that protecting the public health is good business, and it's essential to good, responsible corporate citizenship. The World Health Organization estimates that tobacco kills more than 6 million people worldwide every year. In the 21st century, 1 billion people, 1 billion, are expected to die as a result of tobacco. And many of these deaths are in the poorest nations on earth, with 8 out of 10 of today's smokers living in low-income and middle-income countries. It is unconscionable that the U.S. Chamber of Commerce is going after the laws to protect the people in these poor countries. More than a decade ago, the World Health Organization adopted an international treaty focused on reducing tobacco consumption. This treaty, supported by 180 countries, obligates nations to employ practices to reduce tobacco use. We've made a lot of progress in the last 10 years. 49 countries have passed comprehensive smoke-free laws, protecting over 1 billion people. 42 countries have strong graphic warning labels covering almost 20% of the population that buy these products. These policies save lives, prevent cancer, heart disease, and lung cancer. It's hard to imagine how the U.S. Chamber of Commerce can rationalize policies that literally promote the death of innocent people from the use of tobacco. Hats off to the CVS Health Corporation for stepping up and showing responsible corporate citizenship in resigning from the U.S. Chamber. Maybe if the U.S. Chamber comes to its senses, CVS might consider rejoining it.